Hello everyone. Today we will study regarding congenital heart disease. Congenital means which is present from birth, and in this the heart disease which are present from birth are called as the congenital heart defect. Introduction. Congenital means present at birth, and congenital heart defect are the heart condition that a baby is born with. The fetal heart develops mainly during the 3rd to 8th week of the pregnancy, but due to some reason there will be the abnormal development of the heart which will lead to the congenital heart defect. So it is the most common type of birth defect. जो heart defect है congenital heart defect, it is the most common type of the birth defect. The children may have other birth defects such as the cleft lip, cleft palate या hydrocephalus, spina bifida, but जो congenital heart defect है वो भी क्या है most common defect है. They may affect the shape of the baby heart. How it will affect? Because the heart have to work hard to circulate the body through to circulate the blood throughout the body. So there will be the enlargement of the ventricles here, change in the shape of the heart. Then meaning congenital heart defect is a defect in the structure of the heart and the great vessel that is present at the birth. It account for 1/3 of the ऑल कंजेनाइटल हार्ट डिफेक्ट. अब 1/3 मीन्स कि अगर हम बात करें कि जो ऑल हार्ट डिफेक्ट में 33 मोर देन 33% में क्या होगा कंजेनाइटल डिफेक्ट में कंजेनाइटल हार्ट डिफेक्ट इज प्रेजेंट एंड इट विल अफेक्ट नियरली 1 in 100 birth annually in the United States. So there will be the abnormality in the structure of the cardiac chamber. Chambers हैं cardiac chamber, they are abnormally developed walls and the great vessels in the patient. So it is the abnormality within the cardiac chamber, walls and heart vessels. So congenital heart disease are divided into acyanotic, cyanotic and obstructions. Then first one is the acyanotic heart disease. Acyanotic means no cyanosis is present. In this type of defect, cyanosis is absent and there will be the left to right shunting of the blood. Blood will move from the left side to the right side. तो जो left side का blood है that is more oxygenated. So more oxygenated blood will again go into the right side of the heart. It is divided into two conditions: increased pulmonary blood flow and second is the obstruction to blood flow from ventricle. First one is the ASD, atrioseptal defect, VSD is ventricular septal defect, PDA is patent ductus arteriosus, and fourth one is the arterioventricular canal. In these type of defect there will be increase in the pulmonary blood flow because more blood will enter into the pulmonary circulation. Then obstruction to blood flow from ventricles. In this, coarctation of aorta, aortic stenosis and pulmonic stenosis. So there will be the stenosis in the aortic valve or either in the pulmonary. The next one is the cyanotic heart disease, which include the right to left shunting. In this the blood will directly move from the right to the left side of the heart. Right side blood is less oxygenated and left side is more oxygenated. So there will be the mixing of the deoxygenated blood with the oxygenated blood. So in this cyanosis is present. It is divided into mixed blood flow and second one is the increased pulmonary blood flow. Mixed blood flow include transposition of the great artery, total anomalous which include pulmonary venous return and truncus arteriosus and hypoplastic left heart syndrome. And increased pulmonary blood flow include the TOF. TOF means tautology of Fallot and tricuspid atresia and Epstein anomaly. Then difference between the cyanotic and acyanotic heart disease. Definition की बात करें तो there will be the defect causing right to left shunting in case of cyanotic because cyanosis is present and there will be the direct shunting of blood from the right to left side. So deoxygenated blood enters the systemic circulation. And in case of acyanotic heart disease, defect causing left to right shunting. More oxygenated blood will enter into the right side. Oxygenated blood recirculate to the lungs. So cyanosis, in case of cyanotic heart disease, cyanosis is present, bluish lips and fingers, and in case of acyanotic, cyanosis is absent. Then oxygen level. Cyanotic heart disease में oxygen level is decreased and in case of acyanotic heart disease normal. Shunting direction from right to left and in case of acyanotic left to right. Then pulmonary blood flow is decreased in case of cyanotic heart disease and it is increased in case of the acyanotic heart disease. Then common symptoms include cyanosis, clubbing, dyspnea, squatting in children. In this, the children will occupy the squatting position so that the body need can be fulfilled. And breathlessness, recurrent infection, heart failure sign in case of acyanotic heart disease. Then complication include polycythemia and hypoxemic spells in case of cyanotic heart disease, and in case of acyanotic heart disease, pulmonary hypertension or Esmenger syndrome is present. The next is the incidence. So, congenital heart defect affect 8 to 12 of every 1000 neonate. In spontaneously aborted and stillborn fetuses, the incidence is much higher because there will be the congenital heart defect. There will be severe structural abnormality which will interfere with the normal blood circulation. So, inadequate oxygen and nutrient are provided to the body. So, अगर oxygen nutrient body को नहीं मिलेंगे, there will be more incidence of the spontaneous abortion or stillbirth. Then etiology, 90% of etiology of congenital cardiac defect is unknown. 90% cases में कोई पता नहीं है ये क्यों हो रहा है. But most are thought to be the result of multifactorial inheritance की. इसके लिए multiple factors भी responsible हो सकते हैं जो हम नेक्स्ट स्लाइड में करेंगे. Then risk factor include the fetal exposure to drugs such as the phenytoin, lithium and the radiation. अब जो मैंने आपको बताया कि फिटल डेवलपमेंट नॉर्मली 3rd to 8th वीक में स्टार्ट हो जाती है, तो ऑर्गेनोजेनेसिस उस टाइम पे हो रहा है, फर्स्ट ट्राइमेस्टर में हो रहा है, तो अगर उस टाइम पे मदर किसी ट्रेटोजेंस के एक्सपोजर में आती है तो दैट विल अफेक्ट द सेल डिवीजन, डिफेक्टेड सेल डिवीजन होगा, म्यूटेशन होगी और दैट विल सबसाइड विद इन द नेक्स्ट जो डिवीजन है उसमें भी वो प्रेजेंट रहेगा. तो इसमें फिनाइटोइन की बात करें तो इस जो फिनाइटोइन के अगर मदर लेती है, एंटी एपिलेप्टिक ड्रग्स ले रही है, तो इसकी वजह से फिटल हाइडेंटोइन सिंड्रोम हो सकता है विच विल लीड्स टू द स्ट्रक्चरल हार्ट डिफेक्ट एंड ऑल्सो लीड टू द ग्रोथ रिटार्डेशन. देन नेक्स्ट इज द लिथियम. इफ द मदर इज टेकिंग lithium such as in case of bipolar disorders, then it will lead to the malformation of the tricuspid valve which will also interfere with the normal cardiac development. The next is the radiation exposure. If mother is in contact with the high dose radiation therapy, then it will lead to the damage to the rapidly dividing cell which will lead to the mutation in the cells. Then next is the maternal viral infection such as ki rubella infection, cytomegalo infection या herpes simplex virus. If any type of this infection is present, it will also inhibit the DNA synthesis and it will lead to the cell death which is also called as the apoptosis. And if cell death will occur, there will be the defect in the heart structure like septae या valvular defect may occur. Then next is the maternal metabolic disorder such as the phenylketonuria. If there will be the excess phenylalanine, it will cross the placenta and it will lead to the teratogenic effect on the embryo. Teratogenic effect कैसे करेगा? Impure cell division and it will also have the toxic effect on the neural crust cells which will lead to the abnormal heart development. The next is the इंसुलिन डिपेंडेंट डायबिटीज मेलाइटस. अगर क्या है मदर में हाइपरग्लाइसीमिया है, एक्सेस ग्लूकोज है, दैट विल क्रॉस द प्लेसेंटा विच विल आल्सो लीड टू फिटल हाइपरग्लाइसीमिया. एंड इफ फिटल हाइपरग्लाइसीमिया इज प्रेजेंट, दिस विल लीड टू द ऑक्सीडेटिव स्ट्रेस. ऑक्सीडेटिव स्ट्रेस में क्या होगा? फ्री रेडिकल्स की फॉर्मेशन होगी. अब अगर फ्री रेडिकल फॉर्म होते हैं वो अनस्टेबल मॉलिक्यूल होते हैं और वो स्टेबलाइज होने के लिए अदर सेल्स के साथ वो अटैच करेंगे और जब इफ़ दे विल अटैच विद अदर सेल तो उसको भी वो अनस्टेबल कर देंगे और म्यूटेटेड कर देंगे. अगर म्यूटेटेड है तो जो नेक्स्ट सेल डिवीजन होगा वो भी म्यूटेटेड सेल डिवीजन ही होगा. देन नेक्स्ट इज द मैटरनल कॉम्प्लिकेशंस ऑफ प्रेगनेंसी सच एज द इंक्रीज्ड एज में इफ़ द मदर इज़ इन द एडवांस्ड एज जैसे कि मोर देन 35 है तो देयर विल बी द इंक्रीज रिस्क ऑफ क्रोमोसोमल एबनॉर्मेलिटी. जो oocytes हैं एज्ड होंगे तो उनका क्वालिटी पुअर होगी. With aging, mitochondrial function also declines, DNA damage increases. So there will be chances of the congenital heart disease. Then next is the maternal dietary deficiencies. अगर most common folic acid deficiency, vitamin B12 deficiency. अगर इनकी deficiency होती है, it will cause the defective DNA synthesis, and there will be the abnormal cell division, and there will be the formation of abnormal cardiac structures. The next is the genetic factor. If there will so chromosomal abnormality like Turner syndrome. In Turner syndrome there will be chromosome missing. Total chromosome are 45 in number, or in case of Down syndrome there will be trisomy of the 21st chromosome and trisomy 13 and the trisomy 18. So in this condition there will be chromosomal abnormality, either there will be extra chromosome or the chromosome is missing. This will lead to abnormal gene formation and it will disrupt the normal heart formation or normal heart development. So these are the risk factors, which include drugs, viral infection, metabolic disorder, maternal complication, maternal dietary deficiency, genetic factor, and chromosomal abnormality. So genetic abnormality, there will be altered gene expression and protein synthesis will be abnormal, and defective cardiac development such as looping, septation, valve formation, these all are defective. So it will lead to the congenital heart defect. So in this video we had studied regarding the definition, types of congenital heart defect, and the causes and risk factor of